So if you are very far from somebody, then the chances of you getting the infection is really minimal. So that's one understanding. The other understanding is that the droplets may be on hard surfaces that you may touch. So as you touch, you may touch your eyes, your nose, or your mouth. It may get infection. So in that context, we preach hand washing with soap and running water. So that is the basis for that other intervention. But then there are instances that you may not be able to maintain that required social distance, or what we call the physical distance. So you need to have a blockage. And blockage comes to the use of the face mask, or what we call face covering. And it's very, very important. But the idea is that you are trying to prevent the virus from getting into the mucosa of any part of the body that may get the infection. So you try to prevent your nose, your mouth from the virus from getting into you. So what best can you use? And that's how this idea of a face mask comes in. So the indication is the use of face mask. But then there are instances that maybe you may not be able to use the face mask. And let me be clear. I'm reading from the CDC recommendations. And what he's saying is that it's indicated that face shield is indicated when persons with hearing impairment, or those who care for or interact with a person who is hearing impaired, they may be unable to wear cloth face covering if they rely on lip reading. As we speak now, the gentleman on the left, early stages of this outbreak, you could see they were virtually very nothing. And there was a lot of complaint that why are we preaching face masks and they are not wearing it? It's because we do lip reading. So in that case, you cannot cover the lips and say that you can communicate to someone with hearing impairment. So that is the only indication whereby you can say that I'm now going to use face shield. But for the purpose of addressing the challenge of the infection, the first point of call is the face mask. And I think that we want to employ all Ghanaians that let's use the face mask, because that's the surest way that you can actually prevent yourself from getting infection. If you wear the face mask, the face shield, then it must be on top of a mask. But it should not be an alternative to the use of a face mask. And I want to assure all Ghanaians that it's not for convenience that we are replacing a face shield with a face mask, but the purpose of preventing infection. Thank you very much.
Thank you. Simple and straight point. And if I may reiterate, there's a foundation reason for which the face shield may be used when dealing with persons with hearing impairments, etc., so that when you are, for example, doing sign language, etc., those who do lip reading and those who do the sign language gesticulation as part of the exercise, they are encouraged to use face shields. Ordinarily, if you use a face shield, it must be in addition to the mask. It is not a substitute to the mask. It is a complement, not a substitute. And so we want to encourage the general public so to do. Particularly our colleagues who have some of the major mass media outlets who have guests on your television stations. What you do, a lot of people will also learn from. So we encourage you that you also do the right thing so a lot of people can also learn from it. Colleagues, our final brief this morning has to do with safety in schools. The Ghana Education Service and the Ghana Health Service last night released a statement following the testing on the campus of the Accra Girls High School. This morning, the Ghana Education Service Director, Professor Kwesi Opoku Amankwa, is here with us this morning. He will give us an update on that and then speak generally to the subject of safety in schools. We need to ensure that parents and students have a lot of information so that anxieties are reduced. So, Prof, I would invite you to the podium. Prof was telling me earlier this morning about his COVID status and what he is doing to help us fight stigma. So maybe he will open up with a few comments on that.
Good morning. Thank you, Honorable Minister. I guess you've been working hard with the health professionals. You now almost think health. Yeah. Honorable Minister, the President directed schools should be opened. And first set of reopened was the tertiary institutions. This was followed by the primary institution.
Joy News. Now, we just came back from the Information Ministry. I have to apologize that we had a slight challenge with our connection there. We will go back immediately. We have established a more stable one. But here are the updates on what we learned when we went there. First of all, 3,716 active cases. It's the lowest active case number since we saw that spike we changed our discharge protocol in Ghana. Our number of active cases went up by 1,500 between the 21st of June and about the 2nd of July. It's been going down steadily, slowly since that time. However, the key issue is what's being addressed right now, which we will be taking you to very, very shortly. Professor Opoku-Amankwa, he is the Director General for the Ghana Education Service. He's speaking to the fact that out of 314 persons who were tested in Accra Girls Senior High School here in Accra, 55 of them tested positive and 259 of them tested negative. Now, it's important that we look at this figure because it was 6 just a couple of weeks ago when initially some cases were recorded. There were 6 students and a teacher and a spouse, so that makes 8 people in total. Before yesterday's release came out, a total of 14 students had tested positive in schools across the country, some in Wesley Girls High School allegedly, some in the Fansfilm School allegedly, and a number in these schools that we know. Odogono Senior High School, for instance, had some, we can confirm that Odogono Senior High School had some cases. Kumasi Wesley College had some cases. Now, the question that it has raised on social media really has been about whether or not we should close down schools after this. Joy FM had a poll on Twitter. I'm reading it for you right now. Very, very split views, I must say, because out of 2,226 people who have voted, 39.4% of the public are saying that they should stay in school. The students should not be asked to go home. 37.6% say they should be recalled. And look at a whopping 23% of the voters are sitting on the fence. They say it's a tough call to make. Why is this important? State officials have been repeating that in the first place, students may be infected and we would not know. So if students are infected in these senior high schools, they may carry these infections home. That, of course, is not the case in Accra Girls Senior High School, where we know for sure that 55 people have tested positive. So it will be interesting to see the steps that the Ghana Education Service is taking. I'll take you through a few of them now. They've identified and they've segregated these 55 persons who have tested positive. There's a sample collection and laboratory testing of all contacts identified and suspected cases. All confirmed cases have been transferred to designated national treatment and isolation centers for management. There's a restriction of students that attend dining at a particular time. The question here, of course, is why are the students being restricted now? Because we understand that when the president was giving his 12th address to the nation, he made the case very clear that students are going to adhere to strict social distancing protocols in public gatherings. In fact, some public gatherings were closed down in the first place, in the first place. So there was no assembly, there's no sporting activities. The question here is that why are we now limiting dining hall attendance? But of course, these are questions that we're going to go through the rest of the day, and we will soon be taking you back to that news conference for Professor Opoku-Amankwa to answer a few more of those. There's also enforcement of social distancing protocols, enhanced hand hygiene practices, and the proper use of face mask. Disinfection of the entire school has been carried out. Adequate personal protective equipment, PPEs, have been provided to health staff stationed in the school. Now, there's also education on COVID-19 prevention and control, which has been intensified again within the school. Now, counseling and psychological support is being provided to the students. The school has designated a quarantine, an isolation center. Parents and guardians of affected students have been duly contacted. Staff of the school have been reassured. Now, a few other schools, the statement says, have reported sporadic cases which have not experienced a surge. Now, to prevent the spread of COVID-19 in senior high schools across the country, similar measures are being implemented. It will be important to know which specific measures are being implemented in schools which may not see the large number of cases that Accra Girls has seen, but may have cases. Now, of course, the key thing here is that 314 people were tested in Accra Girls, and 55 of them, nearly a fifth of them, which is nearly 20% of the number of people who were tested, actually tested positive. What does that mean for the positivity rate of that area? Are we then to, what do the health experts say? Should we then extend this positivity rate to all other schools across the country and assume that this is the number of people who will be positive in all of these areas? Or is it a stretch? Of course, there is a positivity rate for the country, the number of people who are being tested totally, and the number of positive tests that we are seeing in those samples. So we'll do a bit more analysis of the numbers from Accra Girls and do a bit more analysis of the steps that government is taking. And we'll take you back to that news conference being held by the Information Ministry. Stay with us. This is News Desk. We'll be right back. Right, so we'll begin with what is happening now. 24,988 cases of COVID-19 have been recorded in the country, 470 new cases, but there is a silver lining. The silver lining is that we currently have one of the lowest numbers in terms of active cases, 3,782. This has been revealed at the ongoing media briefing as the Information Ministry will now listen to Dr. Bedusa Kodie, who is the Director of Public Health at the Ghana Health Service, speaking earlier.
Out of 14 districts, with the majority from Wasa Amenfi East District. The region reported 18 new cases, 6 out of 43 districts, the majority of them from Kumasi Metropolis. Eastern region reported new cases in 3 out of 33 districts, with the majority from Lower Menya. Oti region reported 5 new cases from Kache West District, and Volta region 1 new cases from Achi South. 10 regions did not report any new cases during the period under review, and these regions are Central, Upper East, Northeast, Western North, Savannah, Upper West, North, Afo, Bono, and Bono. This gives detail of the various regions and the districts reporting and the number of cases that were reported from each of the districts. In Greater Accra, the majority earlier mentioned Ayawaso West, Ashaman, Accra Metropolis, Dadi Kotopo, Adenta, Tema, and Koliti. Eastern region, the majority are from Lower Menya Krobo, with cases 3 and 2 from Akwapim South and Krobo, respectively. Western region, the 49 cases were from Asa Amanfi East, Ashama, and Asa East. Ashanti region reported 18 cases, mostly from Kumasi Metropolis. Other regions, other districts From Ashanti, that also reported cases are Bosome Freho, Asukwa, Kwadaso, Bekwai, Achima, Kwangoma. Volta region reported one case, as earlier mentioned, from Akachi South. Oti region reported 5 cases, all from Kachi West. In total, we reported 264 cases and 264 new cases. The next chart gives the distribution of the total confirmed cases and then the active cases in the various regions. The darker the color, the greater the number of cases. And the darkest is in Greater Accra region with regards to the total caseload, also with the active case, followed by Ashanti region. These are the districts that have reported cases within the country. And in Greater, all the districts have reported cases. Ashanti region, the majority, and Eastern region, with the exception of about 3 or 4 districts, all the various districts have reported cases. The next slide gives us idea of the various hotspots that have within the country. The hotspots continue to be within the coastal and middle belt, and Greater Accra with cumulative of 13,869 cases positive, contributing about 55% of total cases in the country. Ashanti region with 5,277 positive cases, contributing 21% of the total confirmed cases in the country, followed by Western with 8.7%, and then Central region with 4.4%. The next slide gives the summary of the various recoveries and discharges per region. And our region, the various total cases discharged are 14. Out of 98 cases, the active cases are 84. Ashanti region, total cases 5,277, 4,819 have recovered, and the active cases are 19. The other highest burden area is the Greater Accra with 13,869 cases, and out of these, 7,327 have recovered with 2,481 active cases. Western region, total cases are 2,189. Total recoveries and discharges 2,068, with 94.5% recovery or discharge, and total active cases are 119. So, as a country, Ghana, total confirmed cases 25,252, 21,397 have recovered, and the percentage recovery stands at 84.7. Active cases 3,716. I think this is the last slide, and thank you very much for your attention.
Thank you, Dr. Medusa Kodie.
So it looks like the numbers have been updated. 25,252 cases in total. 21,397, representing 84%, have been recovered or have been discharged, and 3,716 of those persons are currently active cases. Now, the Electoral Commission says it has no control over how the political parties visit registration centers located across senior high schools once they comply with its rules and regulations. Director for Electoral Services, Dr. Sribo Kweku, told Roland Walker on the AM show, despite concerns being raised, it credits itself 95% for the work done so far.
We use around 3,400 to 3,500, but now we are getting to 7,000.
Okay, and the 7,000 is a full deployment?
Yes, that's a full deployment.
Okay.
So that is the full phase. It's about 6,780, and that's what we are using now.
Now, how many people did you estimate you want to capture?
For the whole period?
Yes, please.
Yes, we are targeting 15 to 16 million.
I don't understand. What is 15 to 16 million?
What I mean is that we are expecting that by the time we will finish the registration in early August, we are expecting that we have registered between 15 million and 16 million.
The register you are replacing, how many people per your records do you have on it?
It's about 16.7. And we are saying that it's booted. So if it's booted, then we are expecting that the figures should come down. I think we are going beyond 100% because our projection was that by the end of first phase, we should have rated about 3.8, and now we have rated more than 4.4. So we have gone beyond 100%. That's bad for the COVID. So I came down to 95 because of some of the COVID breaches.
Now, he also comments on a visit to schools by political party agents and their assigns.
Once you open the place for registration, then by law, the political parties are also accredited to observe the registration. So wherever we are registering, the parties have their agents there. Our responsibility is to go there to register them, and the party's responsibility is also to observe that if somebody is not qualified, they can object to the person's registration. It is the responsibility of the school authorities to determine who goes there and who doesn't go there. It is their responsibility to determine who can have access to the students and who should not have access. Ours is to go there to register them. So I wouldn't know what transpired between Nanabi and the students.
Dr. Sebo, it looks like there are lots of things you don't know when it comes to this one, because the parties are participating, right?
We are doing our registration. We have accredited some of the party executives to also monitor their activities. So if he went there with accreditation, then it is the school who should determine what anybody can do. The commission cannot go there and be giving instructions to them. You should go here, you should not go there. The school authorities are in charge of the schools. Our responsibility is to register them. Some secondary schools are themselves polling stations, so they are registration centers. Meaning that the students over there don't have to go anywhere because they are registration centers. And those in such areas, they are competing with the community around. Because once a polling station, anybody living within that community will have to come to the campus there to register. So the students are registering with the community inhabitants. Then we have people centers which are outside the school campuses. So for some of them, there will be a secondary school here and maybe a nearby primary or JSS. So where the centers are not cited in the schools, they go out of campus and register at the surrounding registration centers. Now, we know that COVID has brought about restrictions. So the GES wrote to us that as part of the conditions for reopening of the schools, the students are not supposed to go out of campus. So we should have them registered. So the commission decided that in that case, we will send the machines to the polling stations, and we have the mobile teams which are already registering people when there are congestions. So we register them at their schools and assign them to the registration centers, which is closer to their schools and which will have served as their registration centers, but for the restrictions. So those people are registered not for the polling station in that school, but the nearby registration centers. So they cannot vote
in their schools if they are not already polling stations. So their names will be sent to their actual polling stations. So I don't think anything has changed.
Now, away from education, multiple operations conducted by the police Operation Vanguard within the Enchi and Asankrega areas of the Western region has resulted in the arrest of 12 suspected illegal miners, including 2 Chinese nationals. The command continues to conduct patrols to disrupt the activities of illegal miners within their area of operations. Commander in charge of operations, Chief Superintendent Ohinebwedi Bosman, laments how the people in Galamsey affected areas are not helping in the fight against the illegal act. Correspondent Anna Sabit was part of operations and filed the following report.
After the withdrawal of a joint military and police task force against illegal mining earlier this year by government, a new anti-Galamsey task force made up of the police were deployed to take over the task of ending illegal mining and safeguarding Ghana's forest reserves and water bodies. The team, as part of its routine night operations, arrested 2 Chinese and 10 Ghanaians who are deeply involved in the illegal act in the Agbozi forest, a suburb of Enchi. One of the police officers, by name Inspector Kennedy John Doche, sustained gunshot wounds during the night swoops and was rushed to the Enchi Government Hospital for treatment. It's daybreak, and now the team have to put behind them what happened the previous night and proceed with its intended operations. This time round with much more focus on seizing and burning the equipments used by these miners in the destruction of the forest reserves. Chief Superintendent Ohinebwedi Bosman is the new commander in charge of Operations Vanguard. He shares with Joy News how the activities of illegal miners is causing much more havoc to the affected communities and the country at large.
If you look at how these galamseyers, the small-scale miners and what they call the illegal miners, if you see the way they've done, the way they've done this, they destroy the forest, they destroy cocoa farms, they destroy orange farms, and all the river bodies, they blocked it.
Chief Superintendent Bosman reiterated the fact that the destructions caused the river bodies are so enormous that Ghana might be importing drinking water from neighboring countries.
In fact, we've done extensively patrols to the west, to the east, to the Ashanti, and even to the north. And everywhere that we go as a Vanguard, we see this devastation. Look at the way they have blocked the river, the Chinese. And some of the indigents have supported them to destroy our water bodies. If care not taken, as I've indicated already, we're going to import water from other countries here. And can we afford that?
From Enchi, we moved to Mosianso, a suburb of Asankragwa in the Wasa Amenfi district of the Western region. Just like the other places we visited, the level of destruction caused by the activities of illegal miners is glaring, as the Tano River, which used to be a clean source of drinking water for the people, is currently in a muddy state.
Now, the river next to this site is known as River Tano, and the color of the river is nothing to write home about. The galamseyers have caused a lot of destruction to the entire environment, the forest zone, the farms, plus the river, which initially used to be the only source of drinking water for the people here.
Chief Superintendent Bosman laments how the people in the Galamsey affected areas are not helping in the fight against the illegal act.
Ironically, all the stakeholders here are involved in this business. All the stakeholders, including some of chiefs. They are all opinion leaders. You see assemblymen, what have you. They are all involved in this activity. So I find it very difficult even coming here. Sometimes you approach them and they will not want to give you any information. They give them money. And another problem we are facing is that all the road leading to Galamsey site, all those people over there, those who sell granite, those who roast plantain, those mechanic shops, they are all informal to the Galamseyers. So as soon as they see our car coming, they inform them. Before you get there, they've all run away. So the population, the public society, in all these mining communities are not helping us.
After a 48-hour operation by the team in the Enchi and Asankragua areas, a total of 12 Galamseyers were arrested, including 56-year-old Wen Rishu and 58-year-old Wen Fukwan, both Chinese nationals. Also, over 100 floating platforms known as Chamfan by the local people were burnt to ashes. Interestingly, 42-year-old Inspector Kennedy John Doche, who sustained gunshot wounds at the start of the operations, was discharged within 48 hours and joined the team back at the camp in high spirits.
I'm not discouraged at all. I made up my mind. It's an operation in which we are trying to deny people livelihood. So I know the dangers associated with the operation. So I set myself up that we are going to defend the country. You know, these are natural resources which we inherited, and we need to guard against it judiciously. So I'm not discouraged in any way at all.
From the operations Vanguard camp in Takwa, I am Anas Sabit for Joy News.
As alive on JoyNews Desk with me, Daniel Daze. It's time for Business with Daryl Kwao. Stay with us. Good morning, everyone. My name is Daryl. Welcome to Business. In our first story, Industrial and Commercial Workers Union is impressing on government the need to expedite payment plans for ex-staff of collapsed microfinance and savings and loans companies. The receiver has announced the payment process will begin this week, but the union says no work has been done. Secretary General of the ICU, Solomon Kote, at a press conference called on the Bank of Ghana to release funds to pre-finance the payments.
According to the Industrial and Commercial Workers Union, the receiver for the microfinance as well as savings and loans companies had signed an agreement with the union on behalf of the former staff of the various institutions but failed to follow the terms of the agreement. Some of the former workers are yet to receive their provident fund and welfare contributions, which are part of the exit package agreed with the receiver. General Secretary of the Industrial and Commercial Workers Union, Solomon Kote, described the inability of the receiver to make the payments as disappointing.
Assuming you have an interface with one of these workers and they tell you their problem, and look at it that we signed this memorandum of agreement in December last year. Okay, how many months now? 7 months now. Wherever they had gone to borrow to make sure that they survive, they have said, oh, in the next few weeks, because that is the message we are having. So we said that the excuses to the unending payment schedule is our problem. So assuming that the pre-financing that the Bank of Ghana is going to do, they have received the money and they have scheduled the payment, that could have been the good news. But as it stands now, those statements, and a particular one that even hurt us the more, was that payment will be arranged in the coming weeks. That makes it open. Nobody knows when. Hence, we feel as a pressure group, this is the time we must let them know what the individual Ghanaians, okay, who too low fault of theirs, what they are going through now, so that we could have a good year.
On his part, Chairman of the Coalition for Collapsed Savings and Loans and Microfinance Staff, Solomon Donko, told Joy Business that the effects of the coronavirus is adding more burden to their plight.
Since August last year, most of us are home. Our savings also have been used to offset loans that we had. So the little savings that you had that you could use it to do something, that one has been used to offset your loan. And then, as we are all seeing the COVID-19, additional expenses that you have to incur because of this disease. In some instances, both husband and wife have been affected. So the hardship is just too much for us.
The union is calling on government to fast-track the payment process for the former employees, or they will take appropriate steps in the coming days.
Other news, German Development Agency GIZ has allocated 110 million euros for emergency COVID-19 support. The agency is expected to allocate a further 130 million euros before the end of the year. Meanwhile, the GIZ, together with Resilience Against Climate Change program, has donated personal protective equipment worth 400,000 Ghana cedis to 14 districts in the Upper West, Savannah and Northeast regions. JoyNews' correspondent Rafiq Salam has more.
Northwest team leader of the Market-Oriented Agriculture Program, MOAP, Dr. Andrew Herbert, before presenting the personal protective equipment worth 400,000 Ghana cedis to 14 districts in the Upper West, Savannah and Northeast regions to help contain the spread of the COVID-19 pandemic, explained why they are supporting such a venture.
COVID-19 started impacting the work that we did and we do in this area from around the middle of March, when because of COVID-19 mitigation measures, we could no longer hold meetings or trainings with large numbers of people. And we were forced to put in place a rotation system for our staff between home and office, which disrupted our normal working patterns. We've been very fortunate, I think, in the northwest of Ghana with relatively few cases, and I know of no one actually amongst our staff or partners who has tested positive for COVID-19. However, we cannot afford not to be vigilant and not to take mitigation measures seriously.
Narrowing the situation to Ghana and to the northwestern part of the country, Dr. Andrew Herbert noted that though the number of confirmed cases are relatively low, they need not rest on their oars, and hence they need to donate the personal protective equipment to those areas.
I'm honored then, as the team leader of the Market-Oriented Agriculture Project in Northwest Ghana, in collaboration with the Resilience Against Climate Change Project REACH, to be in the position of formally handing over to 14 district departments of agriculture, regional coordinating councils for Upper West, Savannah and Northeast regions, what is in excess of 400,000 Ghana cedis worth of COVID-19 PPE. It comprises 5,020 reusable face masks, 212 gallons of alcohol-based sanitizer liquid, 3,236 200 milliliter containers of the same hand sanitizer liquid, 304 jumbo-sized rolls of tissue paper, 1,120 dispensers of liquid soap, 189 infrared thermometers, 102 Veronica bucket stands that are equipped with bowls and Veronica buckets, and 100 foot-operated washing stations, and also to sensitize 5,229 posters. So let us hope and pray that with the use of these items amongst our partners, none of our partners contract COVID-19, and we contribute also towards a situation where we continue to record very few cases of the disease in Upper West, Savannah and Northeast region, or better still, none at all.
One municipal chief executive, Isaac Kutairu Mumin, who received the items on behalf of the Upper West Region Minister, Dr. Hafiz bin Sali, thanked GIZ and the European Union for the kind gesture, pledging that the items would be put into good use.
And there is a need for us to put our heads and efforts together to slow down the effects of the pandemic in the region. And that is why we have to welcome the support from MOAP in terms of providing us with the PPEs to support the farming activities in this region. That whatever donations that are being made today will be put into good use, and we make sure that it gets to the right people for the objective of the donors to be achieved.
Reporting for JoyNews, Rafiq Salam.
And that's it for Business. Sports is up next.